What happens when we die? Near-death experiences, or NDEs, have been widely reported in the general population. However, there's a growing body of literature specifically exploring the experiences of healthcare professionals, including doctors and physicians who have had NDEs. These studies are valuable because doctors are scientifically trained and often skeptical of non-material phenomena, making their accounts particularly intriguing to researchers. We will review a summary of the main themes from the literature. Incidents and characteristics of NDEs in doctors. While there is no comprehensive data on how often doctors experience NDEs compared to the general population, studies show that physicians who do experience them report similar phenomena: out-of-body experiences, tunnels of light, encounters with deceased relatives, and a feeling of peaceful detachment. The content of doctors' NDEs does not differ markedly from those reported by non-medical individuals. A key source on this topic is Grayson B. 2003 in the Journal of Near-Death Studies, which explores the common themes of NDEs experienced by physicians, emphasizing how their experiences mirror those of non-medical individuals. Attitudes and beliefs of doctors post-NDE. Several studies have noted that doctors often report significant changes in their attitudes and beliefs about life and death after experiencing an NDE. Many physicians describe a new acceptance of the possibility of an afterlife and become more open to non-material explanations of consciousness. These shifts are often profound, leading some to change their approach to medicine and patient care, becoming more compassionate and focused on the patient as a whole. A key source on this topic is Fenwick P. in 2010 in the Journal of Consciousness Studies, where Fenwick discusses how the transformative power of NDEs can alter physicians' perspectives on death, making them more compassionate and less fearful of their own mortality. Skepticism versus personal experience. Physicians are often trained to dismiss subjective experiences, including near-death experiences, as results of neurological or psychological processes. However, when doctors personally experience near-death experiences, this skepticism can be challenged. Some doctors become advocates for further study of near-death experiences, while others may remain reluctant to embrace a non-materialistic interpretation, instead searching for physiological explanations like hypoxia or neurochemical changes. A key source here is Parnia and colleagues' 2014 study, AWARE, Awareness During Resuscitation, published in the Resuscitation Journal. This large-scale study involves healthcare professionals, including doctors, who have encountered near-death experiences in clinical settings, and it touches on the tension between medical explanations and the lived experiences of those who have had near-death experiences. The impact on professional practice. Doctors who have near-death experiences often report a deepened empathy and a stronger focus on the humanistic aspects of medicine. Their personal experiences with death often encourage them to provide more holistic care, taking into account not just physical symptoms, but also the psychological and emotional well-being of their patients. A key source for this is Van Lommel and colleagues' 2001 study, Near-Death Experience in Survivors of Cardiac Arrest, published in The Lancet. This seminal study involved medical professionals, including physicians, who discussed how their near-death experiences had a lasting impact on their approach to patient care and end-of-life decisions. Calls for further research. Given the unique perspective of physicians, there have been calls within the medical and academic communities to study near-death experiences more rigorously, especially in doctors. The need for larger controlled studies is often emphasized, to either confirm or disprove the transcendental nature of these experiences and to better understand their effects on the psychological health of doctors. A key source here is Grayson and Bush's 2013 study, Distressing Near-Death Experiences of Suicide Survivors, published in the Journal of Nervous and Mental Disease. This study, while focusing on distressing near-death experiences, includes physicians and underscores the need for future research that examines the role near-death experiences play in shaping healthcare providers' approach to both life and death. The literature reveals that physicians' near-death experiences are powerful and can result in major shifts in their worldviews, professional behaviors, and personal philosophies. Despite their medical training and potential initial skepticism, many doctors who have undergone near-death experiences report spiritual or life-altering consequences that influence how they practice medicine, care for patients, and perceive mortality. Further research is needed to explore the full impact of near-death experiences on medical professionals, as their experiences provide a unique lens through which to understand consciousness, life, and death. As it stands, no one really knows what, if anything, happens when we die. I guess we'll just have to wait and see. But until then, live today as if there will be no tomorrow.